Good evening, everybody. My name is Peter Donnelly. I'm Director of the Wellcome Trust Centre for Human Genetics at the University of Oxford, and it's my pleasure to act as moderator for this evening's event. Just to give you a sense of how it will be organised, we'll start with a presentation from Anne, then I'll moderate and ask various questions, and then we'll open things to questions from the audience, and thank you in advance for your engagement in that discussion part of the evening. I first met Anne probably 7 or 8 years ago in the early days of 23andMe when she was visiting Oxford. I was struck then, and actually having interacted with her rather more since then, very much know it to be the case, of her passion. Anne has a great passion, as I think you'll sense, for empowering individuals to learn more about their healthcare. She has a great passion for changing the world, and in particular changing the part of the world to do with the way healthcare is delivered, to improve outcomes and to improve individual patient experiences. To change the world, I think, needs a certain level of bravery or fearlessness, and Anne's got that as well. She studied biology at Yale initially, so was saying that she feels rather at home wandering around Oxford. It looks just like Yale. And moved on to working as an investment consultant in the healthcare sector for about 10 years before founding 23andMe. So I'll hand over to Anne to tell us a bit more about it.
Is this on? Yeah. It's great to be here. I have my roommate from college is actually here with me, and we've been walking around, and we suddenly realized that Yale actually had no creativity, that they actually just stole all their ideas on buildings and infrastructure from Oxford. So we were a little sad to realize that. So as a quick intro and show of hands, how many people have done 23andMe? Oh, good. For those of you who have not, I think there is one kit on sale at Superdrug. So we'll see if there's a run on kits after this. So I'll jump in a little bit and just give a little background as to sort of why we started 23andMe and a little bit about what we do. So when I was on Wall Street, I was investing in healthcare companies, and there'd be these really awkward moments where I'd be talking to pharma companies or hospitals and be this debate about, there was a data set and it was a question of who owns the data, and the pharmas would say we own the data, and the insurance companies said we own the data, and the prescription benefit managers were saying we own the data, and the insurance companies, they want to own the data. And I kept thinking, I was like, well, like the reality is that you own your own data, and the consumer, you the patient, were not represented on any of these calls. And it started to kind of drive me crazy that so many decisions in healthcare are made for you, but you don't actually have a voice in healthcare. Like frequently you go to the physician and they tell you just what to do, but they don't necessarily outline the fact that there's choices here. And so it kind of became this whole question for me of like, who's actually in charge of your health? So as sort of an exercise, one of the things I did is I went through and I pulled up all my medical records just for fun, and I found this note in there. And it says, note, this mother has had a hard time being rational, as most of us in pediatrics know. And the thing that's fun, as some people know my mother has a lot of energy, and she's very aggressive, and there's absolutely no way that someone is going to tell her what to do or what not to do. And my mother was super proactive about her health, and she was always questioning the physician about what they're doing. And the question is, why is my mother so proactive? And this is my mother and her little brother, David. And what happened is that David actually died from an aspirin overdose when he was 18 months old. And what happened is that David ate a bottle of aspirin before they had sort of child-proof aspirins, and they took him from hospital to hospital to hospital saying, we think there's something wrong. And my grandmother was a really sort of nice, more passive individual. And my mother watched them go from hospital to hospital and watched the doctors boss my grandmother around and tell her that there was nothing wrong. And in the last hospital, they took David screaming from my grandmother and told them to go home. They went home, and in the morning when they called the hospital, they said David's in the morgue. And this really had a huge impact on my mom, who was about 5 or 6 at the time, where she really had this idea that no one is going to take advantage of me. I'm in charge of my health, and you can't tell me what to do. And so my mom, as a child growing up, really emphasized to me more and more that no one cares as much about your health as you do. And that healthcare, as much as we know it's a science, it's also still the art, and you know yourself better than anyone, and that you need to be actually your advocate, and you need to be taking responsibility for your health. So that was the foundation for 23andMe when I started to see that there was this potential for genetics, that personalized medicine could come, and I would see, back in 2000 when the human genome was sequenced, I'd see everybody talking about the potential for personalized medicine and how it would come, but at the same time, I didn't see anything actually happening, and I was really frustrated that people weren't actually starting to bring about the genetics and the personalized medicine. So 23andMe was really started about how do we actually create that revolution? How do I empower individuals to actually bring about an era where genetics is part of your daily life and it's actually part of personalized medicine? So there's been a lot of controversy about what we do. And I think just as a background, it's useful to sort of look at this paper. This is a paper from 1961, and it was a question, it was an attitude, a surveys to cancer physicians where they asked them, would you tell your patient if they have cancer? And today that almost seems sort of ridiculous, like if you went into your doctor and they wouldn't tell you that you had a cancer diagnosis. But in 1961, 90% of physicians indicated that they would not tell their patient that they had cancer. So it just shows you how much medicine has changed, and that more and more in the last 50 years has been sort of a massive revolution where you, the individual, are actually taking charge of it. So there's a lot of controversy about what we do, but I actually think it's just part of the process where you, the individual, are taking more and more control over your health. So this is a book that recently came out by Eric Topol at the Scripps, The Patient Will See You Now, and I think it actually highlights a lot of this change, the fact that it is becoming more and more of a consumer-driven model. It's no longer about you going to the physician and there's just one, you ask your physician, there's one question, but people go online and they have WebMD and they have doctors on demand, and there's radiology services where you can send your slides and you get opinions. There's even a mole scan. You can take a picture of a mole and you can get lots of physicians that are giving an opinion on it. It's a totally new system coming where it is then driven by you, the consumer. So what we've found over the last 9 years is that consumers want more and more control. So this is our mission statement. 23andMe is focused on enabling individuals to access, understand, and benefit the human genome. So when I think about some of the most important aspects for us, the access is a huge component. And it's one of the reasons why we have fought really hard to make sure that it is a direct-to-consumer product. We really want it to be something that you can walk into Superdrug, or you can walk in to go online and you can order it, and that it is easy to access, and that it is also inexpensive. I think one of the things that we fought really hard on is making sure that this is not a $5,000 product, but this is actually 125 pounds. It's something that is affordable for most people. So what is it that you can learn from this? So for a lot of you, you've already seen it. We have medication response, disease risk, so things like Alzheimer's disease, Parkinson's, the BRCA, the BRCA mutations, inherited conditions, so things like cystic fibrosis, and other things that you might pass down to your children, and then interesting traits like the ever controversial coriander. Do you like it, or do you think it tastes like soap? That is one of the more popular comments, or one of our most popular feeds on our website. And then the ancestry component. And what we find is that lots of people, you think you know where you're from, or you have an idea, where your parents are from, but then you look in your DNA and there can be lots of new insights that you can get based on where your genetics actually say that you are from. So a couple stories. This is one of my favorite stories. This is Dr. Z. He is a comedian in Las Vegas. He gave a whole talk that I accidentally walked into about 23andMe, and it was a comedy show. But he talks about the fact that he is a physician, and his father is a physician, and all of his uncles are physicians. And he got his 23andMe results back, and he's super high for blood clots. And he was shocked. He was like, I can't believe this. Like, here I am, this physician. I have this huge increased risk for blood clots. Like, how do I not know about this? And he called his dad. His dad's like, what did Grandpa die of? He's like, I don't know, it's something in his lung. And then, asked, well, what about my uncle? And they're like, I don't know, something in his leg. And then, it turns out everyone in his family has died of blood clots. So here he is. He's like, I'm a physician, And I never even thought to ask these questions, and here it is, it's showing up in my DNA. And so it was one of those things, it's a good example of how what 23andMe is doing is not trying to give a diagnosis. It's not trying to replace the physician interactions. It's not saying it's the end-all be-all, but it's a part of your healthcare, and it's a part about you. And the same way looking at the mirror doesn't necessarily tell you everything about you, it's a clue. You can sometimes look in the mirror and not look good, and you know that there's something wrong, and your DNA can be another just clue in your overall healthcare. So the ancestry part is also fun. This is my friend Monica, my roommate. And you can look at Monica and you can question, like, well, what would she put on, if in the US, what would you put on the census? Like, what is her background? And, she's clearly part African American, but when you look at her ancestry, you can see she's sort of part African, she's part Asian, she's part European. Turns out she has some Cherokee in her. She has a Chinese great-grandmother. Like, she has a little bit of everything. And so it's one of the things that's also interesting here is that so much of medicine is based on where you are from, what your ethnicity is, if you're European or if you're Korean, if you're Jewish. But more and more people look like this. And so how does medicine then apply? And what you can find is that you can actually, Monica actually had a history of breast cancer, or her mother had a history of breast cancer. So then you could actually look in specifically in her DNA and say, does the BRCA variant, is that of an Ashkenazi origin, or where is it from? And then should she actually get tested for BRCA? But I think more and more you're going to have molecular medicine, and the reason why you need molecular medicine is because people are not necessarily just of one type anymore. So what we find more and more is that people actually want to get their genetic information and they want to learn about what it actually means for them. And so the understanding is a huge part of our mission. What we also have found here is that people are getting their genetic information and they want to do something meaningful with it. And I think that more and more, it's one of the things that makes me really happy is that we give this information and that there is this trend of people wanting to be empowered, and they are taking this information and they're saying, I want to make lifestyle changes. Like, what are those lifestyle changes? And the reality is we can't give scientifically anyone sort of the best lifestyle to live. But if we actually can gather enough information, maybe we actually could understand what's the best diet for some individuals, what are the best places to live, what is it that you are prone to and not prone to. So what we're finding is that people are really motivated to make those changes. And we get some of the criticism where doctors will say, okay, well, look, we know everyone should eat well, not smoke, don't eat a lot of sugar. And the information is in some ways so generic that it's not meaningful. But if I told you that you're genetically higher risk for type 2 diabetes, and then it becomes, oh, well, that's actually why I'm changing the way my diet and I'm eating less sugar because I'm genetically at risk, well, then did we just help trigger somebody to make that general information more meaningful for them? So the benefit is the last part, and this is something that we've started to announce, is that 23andMe has really been interested in how is it that we are all going to benefit from this genetics revolution. And I am, like, the genetics revolution for me is one of those things, like, during our lifetime, we'll get to watch this all unfold. We'll get to see what is that benefit of, or what is the meaning of all of this genetic information that's within us. And so how is it that 23andMe can help us actually really reap that benefit? And I think in one of those areas is really going to be personalized medicine. So for that reason, we actually launched something a few weeks ago called 23andMe Therapeutics. And it's led by someone named Richard Scheller, who was leading research and development at Genentech. And the idea here is that how is it that we can look at all of the data that we have and actually get insights into that? And can we actually do drug discovery in a much more effective and productive way? So the way we do is we combine the genetic information that everyone has spat, and then we ask people questions about themselves. So we have tons of different surveys, we have lots of questions, and what we find is that people are really engaged and that they're giving us lots and lots of answers. So we now have over 250 million phenotypic data points from our customers. We have over 900,000 people who have done it, and over 80% of our customers are consenting for research. So it's an entirely voluntary process. People can opt in or they can opt out at any time. But what we find is that overwhelmingly people are interested in actually helping with research. And one of the things I always find is that we have all kinds of enemies around the world, but the minute that they're sick, we're like, oh wait, stop, don't blow them up, let's give them dialysis. So there is this good world energy. And how is it that we can actually capture that to actually, in a really meaningful way, and actually use that for real drug discovery? So this is where I'll conclude. It gives sort of the example of the power of one. And I think that there's very few instances in life where one person can have such an impact. And there's a question in the research, can one person really have such an impact on it? And recently there was an article that actually came out of University of Birmingham. I'm forgetting the author's name. But he found a woman who had the severe reaction to radiation in breast cancer treatment. And he sequenced this woman, and he actually found that she has a genetic mutation that should give her a rare disease known as ataxia, I'm forgetting the whole name, axial ataxia, I forgot the whole name of it. But she should have this rare disease. But here she is, she's a 50-year-old woman, and she has 2 copies of this mutation, and she doesn't have the disease. And this became really important for actually a friend of the company's, Brad Margus, who has 4 sons, and 2 of those sons have this disease, AT. And so now suddenly Brad, for the first time in his life, his kids are in their young 20s, late teens, they have this vision that, wow, there's actually someone else out there in the world that has the same mutations as us, but they don't have the disease. So this suddenly becomes a hope. Like, is this woman that was just found in Birmingham, is she potentially, is there something in her that makes her a drug target? And so it gives that sort of sense of hope, is that when we think about drug discovery, there's massive variation in all of us. So is there something in someone in this room that helps someone on the other side of the world? And so for Brad, it's super exciting that this is something that's coming, because this actually might lead to a drug discovery for him. So it's a good thing to point at the end for the research side that your DNA actually does make a difference, that if we have millions and millions of people coming together, I think we really can make a difference in what we can discover.